Okay, well, very good. I think we'll get started in a minute. It's very good to see everybody. Again, this is the career panel for Summer School of Truth related to the medical field. I'm really glad that you're able to join us tonight. And we have a wonderful group of panelists for you with very diverse, you could say, fields in the medical field. So we really hope that this time could be helpful to everybody. So maybe before we get started, how about I'll just ask a question and please feel free to type in your chat. So I know probably some of you who are here, I think most of you who are here probably are considering maybe pursuing some kind of medical related profession. How about let's just type in our chat. What are you considering? Like what field in the medical profession or healthcare profession are you considering? Are you considering, do you want to be a doctor? Do you want to be a nurse, maybe a pharmacist or a physician assistant? Wow, a lot of surgeons. Okay, pharmacy, very good. Nurse, yep. Okay, very good. Dermatologist, wow, very, very specific. Yes. ER doctor, nurse. Okay, very good. Okay, interested. That's good too, Ezra. Yeah, interested in the medical field. I think some are here just because you're interested. You want to find out a little bit more, and that's very good as well. Yeah. So okay, well, wonderful. It's I think you came to the right place. This is where we're going to talk about that tonight. And again, as I mentioned just a little bit earlier, that we have a wonderful panel of brothers and sisters who are in the medical field or pursuing the medical field. And what we'll do is tonight, we'll first just give them each a few minutes to tell you a little bit about who they are, how they got into their field, and what they do, just to give you a little bit of background. And then after that, what we will do is we'll ask them a few questions. And at that time, we'll also open it up. If there are any particular questions that you would like to ask, feel free to put it on the chat. And even if we can't get to all of the questions, we'll try to get them to you. And maybe if there's something a little bit more specific, we hope that we can give you, at least if this is not the forum where we can answer that, we'll try to get you connected, maybe even with some brothers and sisters who are in the field that can perhaps address some of those questions. Okay? Okay, very good. So with that, how about we'll just get started, and I think I'll let Daniel start. He is one of our panelists. Right? Go ahead, Daniel. I'll give the mic to you.
Okay, sounds good. Can you all hear me okay? You can hear me?
Yes.
Okay. Hi, everyone. My name is Daniel Ding. I live in Riverside, California. I'm a doctor at Loma Linda University here in California, Medical Center in California. I specialize in pathology. I grew up in the church life, actually in the Bay Area in San Jose, California. I went to college in Boston, Massachusetts. I majored in neurobiology in college. After college, I went to the full-time training in Anaheim for 2 years, and then after the training, I went to medical school at Loma Linda University here in Southern California, and then I actually graduated from medical school 2 years ago, 2018, and I'm currently in my residency training here at the same hospital at Loma Linda. And so, yeah, so now I've been in Southern California for the last 7 years, at least 7 to 8 years. So, and so I want to share some slides I have about how to become a doctor. Let me just share it with you real quick. Here we go. And I will present mode. Okay, and so I prepared kind of some slides about how to become a doctor. So here we go. Okay, so what do doctors do, right? I'm sure you guys have seen some on TV, or you have some family members that you know who are doctors, right? And most people, who think about t- doctors are, are those who see patients in an office, right, in a clinic setting, or in the hospital, right? But there are a variety of different kinds of doctors. Um, there are also surgeons, right? If you mentioned that, in the chat, right, you want to be surgeons. So surgeons are people who do operations on patients. Some doctors also deliver babies, right? Those are the OBGYNs. Some doctors treat patients with cancer, right? Those are the oncologists. Some look at X-rays and images, right? Those are the radiologists. And also some look at glass slides under a microscope. These are the pathologists, actually. And then I don't know if you guys know. I'll give you a little trivia here. Do you know what this is on the right hand side, right bottom? Do you know what you're looking at?
Feel free to type that in the chat.
Type that in the chat. Yeah, I can't see the chat. Yes, it is cells. In what part of your body? Anyone take a guess? Blood cells. Perfect. You got it. Yep. These are the cells you find in your blood. So you have the red blood cells and the white blood cells. Very good. And so actually that's a good segue because that is what I do. And so this is kind of what I do. I specialize in pathology, which is not a well-known specialty because we don't see patients directly. I actually look at I guess you can say I look at specimen or that are taken out of patients during surgery. So say for example, someone has a tumor in his body, right? How does the doctor know what kind of tumor it is or what kind of cancer it is, right? First, he takes a sample of it, and then after they take the sample out, they send it to us in the lab. We're the ones who process it, and then we will look at the cells under a microscope. And then after we look at it, we'll write a report saying, is this cancer or not, and what kind of cancer? So this here is an example of what I look at every day on the right side. These are cells. These are actually liver cancer stuff. Right? So how do I know if I should become a doctor, right? So these are some questions you might ask yourself. Do you enjoy taking care of people in their time of need, right? Do you like taking care of sick people? Secondly, are you interested in people's health and the human body, right? Of course, when you're a doctor, that's all you deal with, right? People's health and the human body. And also, do you like taking science classes, right? Do you enjoy biology classes? Do you enjoy anatomy and physiology? How do I become a doctor, right? So first of all, you guys are in junior high school. So I think the journey starts, for me, it started in college, right? You have to take required classes in college and get good grades in those classes, right? Biology, physics, general chemistry, organic chemistry, and English, right? So those are pretty much standard. You have to take those classes to apply for medical school. And then you also have to take something called the MCAT exam. So the MCAT is a national exam. It's kind of like the SAT or ACT. It's 5 hours, and it covers a lot of the subjects you studied in your pre-med classes. And then other things you can do is I would suggest you volunteer in a hospital or a doctor's office, right? You can shadow a doctor. You can volunteer at a hospital, or you can work as a medical scribe. So I recommend these things because they'll get you real life exposure to what a doctor does, right? And also you get to be in a hospital environment, in a medical environment. And then also I would just encourage you in college, actually, the really cool thing is that most medical schools, they will accept people with any major in college, So that means you don't have to study a science major. I know someone who studied history, and then afterwards he decided he wanted to be a doctor. So after college, he took those classes. He did really well. He applied to medical school, and now he's a doctor. So in college, don't feel like you have to study a science major. As long as you take the required classes, you can apply to medical school. But I have to warn you, becoming a doctor is a very long road. You know, it's not going to be instant. 4 years in college at least, 4 years in medical school, and between 3 to 7 years in residency. 3 years is the shortest residency, 7 years is the longest. So yeah, and in the middle, there's going to be a lot of exams, you know. So yeah, so a total of 11 to 15 years in school. You know, so it's a long road, you know, but if it's something you really want to do, you know, and if the Lord leads you along that path, you know, it's well worth it. You know, it's a very rewarding and satisfying job. So if you have any questions, feel free to contact me. That's my email. And that's it. Stop share.
Okay, well, thank you, Daniel. I think that was a very comprehensive presentation about the path of how to become a doctor. How about we go to John next? Is that okay, John? We'll go to you next, and yeah, you can feel free to let us know who you are, and yeah.
Well, hi everyone. My name is John. I'm a physician assistant, and so I also work in the medical field. So let me share my screen with everyone real quick. So a physician assistant, not everyone's familiar with what a physician assistant is. It's very similar to a medical doctor. It's actually a master's program. And so physician assistants are all throughout America in the medical field. Not so common outside of America, but inside of America, you'll find a physician's assistant in almost all the specialties of medicine. You can find them in surgery, orthopedics, ER, urgent care, and family medicine. I personally work with family medicine, and I've been enjoying it a lot. The caveat of what a physician assistant is that as an assistant, we always have to work with the doctor as our supervising physician. So let's say like I see a very complicated case, and I might come to Daniel and say, Daniel, I saw this really complicated case. What do you think about what I should do? And then Daniel would advise me what I should do. Then I go back and I carry it out. You know, maybe write some medication for the patient, do whatnot. Okay. So how did I get to become a physician assistant? This is a picture of my son, Noah. So first off, I studied. I studied a lot. I think that's going to be the underlying thing with all of us. If you want to get where you want to go, you'll need to study, and you'll need to study a lot. So I got a degree in biology for the BS. I studied with a specialization in neurobiology. I worked in a lot of research labs during my undergrad years, and I really enjoyed the research. I then went to the FTTA, which I found very useful, helpful, and I really enjoyed it. I served for a year on campus at UT Austin. Then I got a desire to go back into the medical field, so I started working as a phlebotomist in a blood bank and also as a pediatric laboratory technician at the same time, 2 part-time jobs. I then got married, praise the Lord. Right after I got married, I got accepted into grad school at Midwestern University up in Illinois, and that's where I became a PA. So you might say, why did I choose to become a PA? Well, my background was, I have a lot of family members in medicine. You can see my grandfather here on the right. He was a family medicine doctor, and he was a big influence for me throughout my life. Some of his daughters, my aunts, also became nurses. And so I just grew up in the medical field. My father got a degree in biology, and he really loved science. And so he taught me a lot of science as a kid. So I became interested in science and healthcare as a child. Why a PA in particular? Well, one of the saints one time sat down with me and told me about what a PA was. I didn't even know what a PA was at the time. But she mentioned to me how it can be very good for the church life and for the family life. As a PA, you don't take on quite as much responsibility as a medical doctor. So sometimes you can get a good job that you can still practice medicine, but also be able to maintain a good, healthy church life and family life. Finally, there was the inner leading. I took a step of faith, went towards being a physician assistant, and then inwardly there was a confirmation that I should go this route, and so I continued to maintain being as a physician assistant because of the inner leading. So I appreciate the Lord being in the whole process. So currently my profession is in family medicine. I work with pediatrics through geriatrics. So you can see a picture of my family here. This is my dad, my grandfather, my father-in-law, and my son, Noah. So if they were my patients, I would work with all of them. My hours are 8:30 to 5:30, Monday through Friday, Saturday 9 to 1, like once a month. My typical cases are diabetes, high blood pressure, common colds, rashes, anxiety, depression, annual physical exams. So it's a, I wouldn't say it's a simple job, but it's a job, and it's not bad. So I've been enjoying my job actually quite a lot because I get to take care of people. My favorite patients are actually, I don't know if you can see my cursor or not, the anxious and depressed patients. I love these patients because, you know, I also have anxiety and depression, and I can tell them about the real solution to their anxiety and depression. And that's very precious. To be able to take care of a person's body, soul, and spirit. And very enjoyable. So I have a question for all the young people. What is the highest profession on earth? Right? What is the highest profession on earth? Well, I heard a quote just today, and I wanted to share it with you all. The highest profession on earth is to spend time being infused with God, so that we may glow with God and shine forth God. So after this presentation, if you're not convinced I need to be a PA, or you're kind of confused, I need to be a doctor, I don't know what I should be, don't worry. The highest profession on earth is to spend time being infused with God, so that we may glow with God and shine forth God. Amen. So as long as you're spending time with God, you'll be okay. Amen. That's it.
Okay, very good. Well, thank you, John. So that was very good. Thanks for that. So how about let's go to Ruth. Is that okay? We'll go to Ruth.
Hi.
Go ahead.
Hi, my name is Ruth. I live in San Diego, and I've been a pharmacist for 16 years now. I can't believe that went by so quick since I graduated from pharmacy school. So I'm going to go ahead and share my screen and go through some slides about pharmacy. Can you guys see that? Okay.
Yes.
Okay. Everybody can see it. Okay.
Yes.
Thanks. Okay. Sorry. Okay. I just want to give you guys a little background about pharmacy, because I think not that many people know about all the different opportunities within pharmacy. So just to start off, basic, dictionary definition: a pharmacist is a person professionally qualified to prepare and dispense medicinal drug. And what does it take to become a pharmacist? So, obviously an interest in healthcare and science, particularly if you like chemistry or biochemistry, that would be good. A strict attention to detail, very important, being able to multitask. And so the degree that you need is a postgraduate Doctor of Pharmacy or PharmD degree. And there's a lot on this slide, and I'm not really going to go into detail about it, but I think most people just think of pharmacists as your, community retail pharmacist, the one behind the counter at Rite Aid or CVS. And probably the majority of pharmacists are in that setting. However, there are many, many other settings. Hospital is a big one. Pharmacists can specialize in many different fields, similar to physicians and physician assistants. Clinics, infusion pharmacies, pharmaceutical companies. You can teach at a university, work at a compounding pharmacy, work for drug information companies, insurance companies, and also be part of regulatory bodies such as boards of pharmacy. So my journey to becoming a pharmacist, in middle school, high school, I had an interest in science and healthcare. I took AP Bio, AP Calculus in high school, and then I studied biochem in college, and I volunteered in a variety of healthcare settings. Like Brother Daniel said, it's good to, volunteer in a hospital, volunteer in different places, if you're interested in different healthcare professions, to figure out which one is good for you. So I talked to a lot of different healthcare professionals, had fellowship with the brothers and sisters, prayed a lot in college. And finally, the Lord led me to pursue a path in pharmacy. So I graduated from UCLA with a BS in biochemistry, but you don't have to major in biochemistry as long as you take the required prerequisites. You know, you should study what you like. Then I attended the FTTA for 2 years, which I really enjoyed, and it's so worthwhile. So I definitely encourage it if you have the opportunity. So while I was there, I took the pharmacy college admissions test, and then after I finished the 2 years in the FTTA, I then went on to the UCSF School of Pharmacy. It was a 4-year program back then. It has now changed to become a 3-year year-round program. Got my PharmD, and then I was very set on working in a hospital. So I did a 1-year pharmacy practice residency back to UCLA again. And then my first job was at a hospital in San Diego. Moved to San Diego because I met my husband, and then we got married like while I was at that first job. So, okay. However, I do want to present an alternative to you guys. If you know you want to be a pharmacist in high school now, there are 6-year doctor of pharmacy programs out there. You can be admitted right out of high school, skip your bachelor's degree, save a lot of money because pharmacy school is getting more and more expensive. So if you know that this is what you want to be now, this is a good option. And I've just listed some different schools, but you know, you can do your own research. There's a lot of schools out there. And then I mentioned a residency. It isn't required if you want to become a retail pharmacist, but if you want to work in a hospital, it is definitely, most hospitals will require it now. And then if you want to even specialize within the hospital, like to become an oncology or infectious disease pharmacist, then a 2nd year is required as well. And then there are also other residencies available for specific specialty fields. So what am I doing now? Now I'm a manager at an infusion pharmacy performing sterile compounding of IV meds for patients to administer at home. So I was very intent on going to the hospital. However, the Lord touched me like with all of the variable shifts, working weekends. I was missing, you know, church meetings every other weekend, and working nights, sometimes wee hours of the morning, depending on the shift. I realized that I needed something more practical in the hours for the church life. So I've been at this infusion pharmacy for 13 years now. So a typical day at work, and this is my day as a manager, not necessarily as a staff pharmacist, but I arrive at the office, you know, check emails, check meds that we dispense to patients that day. We round with the team twice a day, and our team consists of pharmacists, nurses, insurance specialists on the new patients that we admit. And then throughout the day, you know, I'm creating prescriptions, I'm performing calculations on their medications, collaborating with other healthcare providers like the other saints here to make dose adjustments to their IV meds. I attend meetings, lead meetings, and then, you know, ensure that we're following all the laws and regulations that we need to. So because in my line of work, we tend to get our patients later throughout the day as they're discharged from the hospital. We are busy in the late afternoon. So my schedule is, you know, later in the day. I get in around 10 and 7 or after. Overtime is not uncommon. I work 4 days a week, usually 9 to 10 hour days with on-call some nights or weekend, but the on-call is pretty light. And then as a staff pharmacist, you get paid hourly, but as a manager, you do have a lot of extra things you have to do. And so sometimes I'm logging in from home and things like that too. But compared to what I was doing in the hospital, this is still much better in terms of the hours. So yeah, so if anybody has any questions, please feel free to reach out to me, and that's my email. So thank you.
Oh, thank you, Ruth. That was very helpful.
You're welcome.
Okay, how about let's now go to Brother Tai. Is that okay, Brother Tai? We'll give you the opportunity here. And yeah, Feel free.
That's my screen.
Yep.
Okay. Okay. My name is Ty. I was born in Vietnam. Came to the U.S. as a refugee, and got saved. Came to church life when I was in high school. So I've been a registered nurse for about 10 years, and you know, two things I can assume for most of us here is that a nurse had taken care of us once, at least once in a lifetime. Is that true? Yeah. Okay. That's the day when we were born, right? A nurse was next to your mother, right? Probably shaking us or spanking us so we breathe, right? And then another assumption I can make is that when I say nurse, stereotypically it evoke an image of a female nurse in our mind, but that's changing. So currently, I am a psychiatric mental health nurse practitioner student. I have my master's of science in nursing. And did you know that the Americans rated nursing as the most honest and ethical profession for the last 18 straight years? And nursing ranked second only in 2001. That was a national tragedy that happened in 2001. Do you remember what that was? It was September 11, right? So the firefighters became first in ranking as the most honest and ethical profession then. Nursing is the largest healthcare professions in the US because there are over 3 million nurses in the US and about 20% are men. I'm one of those 600,000. So we need more men to come into the nursing profession. And nursing does have its own body of scientific research, knowledge, and their own theorists. And it focuses really much on holistic patient-centered care of the patient's body, soul, and spirit. And majority of the nurses are working in hospitals, you know, along with the doctors and pharmacists and other professions, PT, OT. So nurses spend most of the time with patients, but some do work in the clinics, community health clinics. They do case management, home health, or even become nurse instructors in nursing schools. And what do nurses do? They assess, they monitor the patient, they educate the patient and family, they lead, they collaborate, they coordinate, they communicate, they pass medications that the pharmacists hand over to them and that the doctors order. They carry out doctor's treatments for the patient, provide comfort, hygiene, hope, compassion, empathy to the patients and their family. And it's a very mobile profession, it's well paid, you'll see later. It's lifelong learning, like I'm learning right now to become a psychiatric nurse practitioner. Advancement opportunities is a lot out there. And most nurses work in the hospitals, majority of those 3 million nurses, and they work only 3 days a week and 12-hour shifts from 7:30 in the morning to 7:30 at night, or the night shift. And then they get 4 days off. And some nurses, they want more money, so they take on another job of 3 days. So it's up to you, but it's very flexible. So how to enter nursing, there are core nursing levels in education. LVN and LPN, it took about 1 year, but the scope of practice is very limited. The pay is very limited if you become a licensed vocational nurse. Of course, the majority of nurses now are getting their Bachelor of Science in Nursing. That takes 4 years. And like me, I got my Master of Science in Nursing. That took me another 3 years. And currently, I'm doing my NP, which will take another 3 years. So what classes do they take as nurses? We take anatomy, physiology, microbiology, chemistry, leadership classes, pharmacology. We do research, and many other general educations. After nursing school, even though you graduate from nursing school, that doesn't mean you become a nurse. All graduates have to pass the National Council License Exam, we call NCLEX. So if you pass that exam, then you get a license number to become a registered nurse. So you might do really well in nursing school, but you came out and failed that test, you are not a registered nurse. You cannot practice. You cannot get a job. So the NCLEX is to ensure standard of public safety because we do deal with patients. So we wanted to have safe practice. And then there's just some pictures of me. I did attend the FTTA graduation. You see me there in the yellow. And I didn't know my wife, my future wife, was standing behind me. We didn't get together until 2 years later after our graduation from the training. So, and then my RN graduation, my MSN graduation, and my Psych NP clinical that I'm doing now. And then, okay, people become nurses with different reasons. So some would be, maybe they've been a patient before and they saw a nurse taking care of them. So they say, oh, one day I want to be like that nurse. Or a family member has a sickness. Or like me, my parents had a stroke. So I want to learn more about healthcare. So I became a nurse. And job security, I want to have, promote healthy living, healthy lifestyle. So my education pathway is that nursing is my second career, because when I was in college, I didn't get the guidance that a man can become a nurse. So I didn't really even think about it. So I started majoring in architecture, and then I kind of changed career and eventually graduated with my computer information systems degree. And then I went to the FTTA, and then I did all my nursing stuff. So I'm expected to graduate from my NP school. I can't wait to graduate so I could celebrate finally after all this schooling. And at the advanced practice level as an NP, or doctorate of NP, nurses can specialize in many specialties, such as a nurse anesthetist. You could work in the OR with the surgeon to sedate the patient for surgery. Or if you like delivering babies, you could become a nurse midwife to help delivering babies, or even work as a chief nursing officer overseeing the nurses and in the hospital, or become a nurse educator or family geriatric pediatric nurse practitioner. And for me in the red, I'm going to become the psychiatric mental health nurse practitioner to treat mental disorders, like the one that John mentioned, the typical one: depression, anxiety, bipolar, eating disorders, substance use disorders. So there are many more other specialties, very flexible with nursing. And at the advanced practice level, like my specialty, on the left, some states allow full practice for nurse practitioners to do all those 12 tasks. Prescribe medicine, diagnose the patient, treat them, provide psychotherapy, make referrals, so all those things. And about wages, this Department of Labor, California especially, has a high wage annual salary rate. As you can see that in California, average worker of a nurse can get a 6-digit salary, which is very doable for if you're a single person with that kind of salary. You can be well off. In the U.S., the average earning is about a little lower, but in California it's a lot. So I provided you with the website where I got that salary wage information from. It's called onetonline.org. And then this is my contact information if you want to know more about the pathway entering nursing. Thank you.
Okay, thank you, Brother Tai.
You're welcome.
Very good. So the last one on our panel is actually Gloria, and I'll let her go ahead and introduce herself.
Hi, everyone. My name's Gloria Huang. I go to nursing school in Riverside, California at a community college. It's called Riverside Community College School of Nursing. I'm in my second year, my third semester, and I'll be able to take the NCLEX in a year from now. A little bit about how I decided to become a nurse was when I was young. I think I was 8. I got really, really sick, and I had to be in the hospital, be in and out of the hospital for almost a full year. And one of my very distinct memories was how much and how well the nurses took care of me. And I remember one nurse, she took me to the gift shop because I was stuck at the hospital for a long time. So I was just, it was really hard to be there. So she took me to the gift shop and she let me, you know, buy something I wanted. And I just really remember that. And that really stuck with me. And so I think I already knew what I wanted to be when I got into college. And then during college, before I got into nursing school, I got sick again. I got a kidney infection. So I was in the hospital for like about a week. And I think that was a really good thing because it helped put me in the patient's position to understand how the patient feels rather than treating the patient as a nurse. And so that really helped prepare my me for when I do become a nurse. I know how the patient is feeling in a more yeah, I can relate to that person more and have my care for them be better quality. So that's a little bit about myself. I have a few pictures to show. How do I, slideshow. Okay. So this is my program. There's, I'm in the bachelor's program. And so there's 40 people in my cohort. And these are some of my classmates that are along for the ride. This is at our campus. We're just taking a break from in between classes. This is me. We're doing, this is currently, we were learning about OB, so mother and baby. First we learn with these, you know, fake babies, and you can see in the back there's dummies in the beds that we practice on before we get into the class, into the actual hospital setting. So here, this is the OB clinical, and so we learn how to not only take care of the baby, but we learn how to assess the baby as well as the mother before and during and after pregnancy, mostly birth. This is one of my classmates. We were getting our N95 mask fittings because we were, we had to do COVID-19 testing as part of our clinical hours. And so you can see here on the table, there's different sizes of N95 masks. And part of the fitting is you put the bag over your head with this mask on, and they spray a smell. And the mask is supposed to, if it's properly fitted, you won't be able to smell that smell, and that shows that it's working. And they make you like talk and bend over and move around to make sure it's properly fitted. This was COVID testing. I wasn't able to get a lot of pictures, but here's our uniform. And then this is my clinical instructor. This is my clinical group. We're split between, each clinical group has 10 people, and we're sent to different hospitals. Yeah, and so this was during one of our clinical days, and our clinical hours are usually, we do 12-hour shifts to prepare us for actual nursing. Yeah, and then during a typical clinical day, we shadow a nurse that our instructor pairs us up with, and the nurse does her shift, and we see everything that she does or he does. And sometimes you can go down, you get to go down to the to x-ray, to the patient needs a what's it called, a PICC line, which is more than just an IV line. Or sometimes you actually help transport a a body down to the morgue. So you get to see all this kind of things as a nursing student. And so far, I have done medical surgical rotation. I've done the OB obstetrics rotation, as well as a regular. It was just a pretty normal floor. I forgot what it was called, but yeah. I think that's it. Oh, and some of the things that as well that we learn in class, we learn what Brother Tai does is mental health, and we learn about pre-op, intra-op, post-op, palliative and hospice care, and we learn about blood administration. Yeah, and we do a lot of care plans. Yeah, to learn how to take care of our patient from the very start of their admission to the very end, and even home health nurses, where we go to the patient's home and take care of them.
Hey, very good. Thank you. Okay, so anyway, I really enjoyed all of your speaking, brothers and sisters, related to your profession, how you got there. I think Daniel had already posted in the chat to see if anyone has any questions. I think Ezra had asked one, but before we go to that one, I do have a question, and maybe I'll direct this one to Daniel first. So it looks like all of you have spent a lot of time in school, right? Years and years and years in school. And then when you mention work, it seems like it's also not that easy. Nurses, 12-hour shifts, and then Sister Ruth, used to work at nights and all these things. So I guess one question I have is, in that kind of a busy schedule in school as well as in work, can you really be in the church life in this kind of a setting, and can you gain the Lord in that kind of environment? What is it like to be a believer in the church life and also have to carry out these very, very demanding kind of jobs or requirements for school? Maybe we can start with Daniel, and you can just share a little something. Yeah.
Yeah, sure, definitely. My answer to that is a resounding yes. Actually, I believe in my experience, my being in the church life was a real salvation, like for me during my education and a supply. And actually, I was really blessed because while I was in medical school, I was living with three brothers who were in the same program as I was. They were all my seniors. They're all ahead of me. And so because I had these companions, they were all they were all post FTTA graduates, and we were all in the same program together, and just to have them there to talk to even to just to receive some help from them practically in my classes and advice, humanly and spiritually, that was a real supply. That was very I think that really sustained me. So the first point is having companions is very important. Secondly, I would say being part of a regular either home meeting or just being attached to a home or a family is also really, for me, it helped me so much, because as Ken said, right, you'll be very busy. You'll be tempted to just study all the time, or you'll be in the hospital all the time. But all of us need some sort of recreation, right? We can't be studying 24/7, right? So for us, our recreation, or at least mine, is the church life. I know other people, they have other kinds of things that they do for fun that aren't so good for them. But for us, what a blessing it is. We have the church life. Church life is our real family. It's our recreation. So I just enjoy, being part of a regular home, having a family that I could go to, to just do something outside of medicine, right? to have that kind of refuge is really for me, it helped me so much, and it was a real supply to me.
Wow. Thank you.
I wanted to just share a little bit also on that same line. When I was in PA school, I had mentioned I had gotten married right before. And although that was really hard on my wife, I was really thankful because my wife was she was strict. She was like, okay, we have to go to the prayer meeting. We have to go to the Lord's table meeting. Okay, okay. And so it was hard to get to the meeting, but I was never sad I went to the meeting. It was always a big supply. And I'd go from meeting to meeting. And it was always felt like the church life was a big supply to get through PA school. So I would say, I'm very thankful to be in the church life. And the way that we made it is we just scheduled. We just set that as a top priority to make it to the meetings. And then we'd spend massive amounts of time studying afterwards. But I would say it's doable. As long as you set that as your goal, it's doable and it's very helpful.
Well, John, while I have you here, I also noticed all of you have gone to the FTTA. That might be something that's in common for all of you for some reason. Anyway, all of you are working in different fields of medicine, but somehow you all went through this full-time training. Like, do you recommend going to that before, say, going to some of these professional schools that takes years, or do you think it's better just to get on with it after college, for example? And what's your experience like?
So I went to the full-time training before PA school. It was very helpful because going through the training, it helped me with my character. It helped me with my person skills, things like that. It was very helpful. I wouldn't say it's a requirement to go to the training before you do it, but I definitely think if you have the time and the ability to just grasp it, because regardless of your job, regardless of where you go in life, the FTTA is very helpful. There's another saying that I heard in the past, which is, it's more important who you are than what you do. And so, like, the FTTA helps form you into who you are. And when you graduate, it's really helpful in whatever profession you do. But I know Gloria hasn't been to the FTTA yet.
Yeah, that's true. I started from community college and then got into my program. And I think that this nursing program, the amount of time is also 2 years. The training is 2 years. And actually my peers my age, they actually went on to the training. I wasn't able to because you need your bachelor's to get into the training. So as they went to the training, I'm here in nursing school. I realized that this is my training before I go to the actual FTTA. And I think it's very good regardless, that it's okay that I'm not in the training because I still am being trained right now in this program. They really they have high expectations of you. There's no, they're quite strict about, being on time, showing up. You need to be in uniform to the T. You get written up if you don't have if you don't have black socks, even though, you can't see your socks, right? You have long pants, but they will check. And then if your hair needs to be tied in a bun. And if you have, flyaways, they talk to you and tell you that's not okay. So, so in that sense, that's my training. But, and I appreciate that because I hope to go to the training right after nursing school. And I think that the scheduling and the requirements are helping me to enter into the training more prepared so that I can focus more on enjoying the Lord.
Very good. Okay, so I'm going to take maybe a couple of these questions from the chat. Maybe I'll go to Brother Ty there, if that's okay. So there's one question I think that's related to it seems like all the medical professions require a lot of commitment, right? You're studying a lot, you're doing a lot. So the question is it possible to go through all of that and maybe later to switch career for some reason? And then also maybe tagged along with that is it seems like there's a lot of hours of studying and working. Like what motivates you to continue with the studying and all these kind of things? Maybe I'll just give that to you and maybe you can answer that one.
For the changing careers, once you're really into a field, you have invested a lot of time, a lot of energy, a lot of money. So I don't recommend that you would change out to something else, like for example, nursing to engineering, because it's totally different field. But if you want to change within nursing, let's say you were interested in, let's say, critical care, the ICU, be a critical care nurse, advanced practice critical care nurse. And then you say, oh, it's too stressful, it's too hectic, it's too chaotic. I want to do more toward pediatrics, outpatients. So within the same nursing field is okay, but not outside of that. That will waste all your education, energy, and career. So even if before you get into nursing, recommend to talk more, research more, even before you commit to applying to nursing school, because it is tough going through nursing school, as Gloria can testify. And then the other question, to stay motivated to continue in the nursing career. For me, I invested a lot of time, energy, and money, and sacrifices. For me, it's a lifelong learning career. And the more I advance within my field, my scope of practice, what I can provide in healthcare services get broadened. And of course, with that comes along compensation, salary will increase along with your education and your increase of practice in the scope of what you can do for patients. So that's the motivation, is continue learning. Of course, the tangible reward of higher salary will come along. Don't worry about that. But it has to be an inward commitment to, like what I'm getting into is mental health, psychiatric nurse practitioner level kind of care. In the U.S., there's a shortage of psychiatric providers. So an increase of mental disorders in the U.S., as you know, a 30-fold increase. I'm going to concentrate on adolescents in my focus of practice in the future after I'm licensed. So my population would be children and adolescents, where I hope to make a difference to improve their mental health. So I hope that answered your question. But always email me, text me.
Very good. Okay, so there's also a couple of questions. I think one is related to what is it like to shadow a doctor? Maybe I think someone mentioned that. I'm not sure if who wants to take that. What is that like? And there's also a question related to, it seems like as in the medical profession, you have to make some pretty quick and fast decisions at times. Like what helps you with that, or something like this? Does anyone want to take that?
Sure, I can take that question.
Sure.
Yeah, I felt like in college, I had to make a decision pretty quickly. I explored different healthcare fields, and I think it wasn't till like going into my 4th year at UCLA that I decided. And so, like I had mentioned, definitely go volunteer if you're, exploring medicine. Be a candy striper, go to the hospital. If you're thinking about pharmacy, see if you can volunteer in a pharmacy, or, maybe shadow a nurse and talk to other people, other saints that are in those professions. I definitely did that. And I prayed a lot, both with like older sisters and with family members, until I became clear. And of course, you have to have the environmental opening, of certain doors too. So it was like all of those things I did, the practical things, the shadowing, the asking the questions, and prayer and fellowship, and then following the peace within. So.
Okay, thank you. That's very helpful. Yeah.
Yeah.
Yep.
Yeah.
Anybody else that?
Yeah.
Okay, go ahead,
So,
Daniel. Yep.
yeah. So, I did shadow a few doctors, actually before medical school and during medical school. And that's basically you would follow like a doctor around as he sees patients or in his normal day-to-day job. So that, for example, I followed a family doctor, and I went with him as he saw his patients room by room, and you're basically like a fly on the wall, you just observe. If you want to get more involved, you can also, there's a job called a medical scribe, and you'll get paid. You're also there with a doctor, but you basically take notes for the doctor, and you're the one who's typing the notes, and you're basically in on the action, right? And most medical scribes work in the ER or in a clinic, so that's a little bit more hands-on. Yeah, but those are the two most common things you can do.
Okay, maybe just the last one, and then we'll end. And of course, feel free to post any questions, and we'll try to get them to you if there's a way. And at the end, we'll also have all these brothers and sisters post their emails, so you can also contact them directly. So I think these two questions are maybe go together. One is, I saw one question is, with all of this time that you spend in the field, I think someone asked, do you have any regrets in investing so much time in what you do to be in the medical field? And then I think along with that is, does your work give you a lot of joy and meaning? I think maybe, I wonder if some want to just share a little bit on either one.
Sure, a little bit. So overall, I really like my job. It's very enjoyable. I don't have many regrets for entering into the job as a PA. But at the same time, I don't have a super high expectation of my job. What does that mean? So some people maybe might say, I want to be a doctor so I can serve the saints and take care of their physical health and things like that. In a day, I think I've seen maybe 3, maybe 4 saints in my practice throughout my years of working. Day by day, I don't see a lot of saints. I just am caring for just normal people day by day, and taking care of them my best that I can. So it's a fun job. It's enjoyable. It's very stressful, but it's fun. But it's not where I'm finding my satisfaction. And I think if you keep that in mind, it'll alleviate some of that tension, because I think all the panelists could probably say the same thing, that this is not our satisfaction, it's our job. But some of us like our job, some of us don't like our job. My job is a pretty good job, and it's okay. I like it. But it's not everything.
Okay. I don't know if Ruth, you want to add to that what Daniel just shared. I mean, what John just shared, or.
Sure. Yeah, I would have to agree with that. While I've invested so many years, so much time and money, and I feel like, I'm constantly learning on the job and will continue to learn. And I find a lot of joy when I, talk to patients over the phone. I actually don't see the patients, our nurses see them, but I talk to them over the phone. And when I ask them how they're doing, and they're doing well, and they're so appreciative, I do have a lot of joy and satisfaction in that. But I would have to agree with John that, it's still just a job, and, we're here for the church life, we're here for the Lord. So that's, that's what I'm here for. And the job, allows us to, live in this world, right? And carry on the church life and have a home to open for the students to come over. So Yes, I enjoy my job very much. I do find, I do find some amount of satisfaction when I talk to our patients, but, I think all of us can testify that, the church life and serving the Lord is our real satisfaction.
Okay, very good. Well, it looks like it's 9:02 and we don't want to everyone to stay up too late. So how about can we just have the panelists put your email address on the chat so that if there's any questions, of course, I think any of the young people are welcome to directly ask these panelists. And we just, thank you so much for joining us. And thank you, Saints, for giving your time to the young people to share with them your experiences. I think that was very helpful. And so we really do hope that the Lord will continue to bless each young person here in their seeking of the proper profession in their human life. And okay, with that, thank you very much for coming, and we will end this session here. And again, feel free to stick around a little bit longer. If anyone has any questions, we'll stay here for another maybe 5-10 minutes. If there's a need for anyone to ask any specific questions, if you want to chat any of the panelists. Other than that, thank you for coming, and we'll end our time right here. Okay, thank you.
Is it for young people in Southern California?
I like Ezra's question about how do you make fast decisions? In my practice, the way to make a fast decision is to practice over and over and over again. And once you've made that decision like 30 times, you're like, oh, this is not anymore. But in the beginning, all of your decisions are slow.
Yeah. I would say, like, for big decisions like regarding your career, it's probably good to do it slowly rather than fast. But yeah.
Hi, Saint. Sorry, I'm using my husband's account. I just have a question. My daughter, she's really interested in doing medicine, and so I have called a few hospitals to get her for volunteering work, or even just to shadow. But they do have the requirements are the age. They have to be at least 16 in most cases in order for them to be qualified. She's only 14. So do you know of any other programs that that may allow younger age to volunteer, or maybe there are other places besides hospitals? I can understand why hospitals can be very strict about it, but do you know of any other places, suggestions where she can volunteer at a younger age than 16?
Some of the family medicine clinics might be a little more lenient. You can just call all the family medicine clinics in your neighborhood. That's an option.
Thank you.
Okay, another option you might consider is if you know some relatives, friends who are in the medical field, maybe you can ask them personally if your daughter can shadow for a day or a few hours, if not a day, a couple hours. So maybe between a personal friend who's in the medical field. So you have to get into the whole organization, application for that.
Oh, well, that's great, Ty. I'm glad we have you.
For my time volunteering in the ER, there's some I think you have to be a certain age. I think in high school you can start that program, but it's called like it's Kaiser. I forgot what it was called, but everyone who has the desire to get into med school, they tend to get into that volunteering program in the hospital. And it's supposed to be really good to prepare you for, med school.
Sorry, did you say that's Kaiser?
Kaiser, yeah.
Okay. I'll look into it. Thanks.
Yeah.
Okay, well, I
Sorry,
think.
it
Oh, go ahead.
sorry, very quickly. Nobody else is asking the questions. Just one more question. Why is that? Why are the advantages and disadvantages in going into a direct 4-year, science bachelor program as opposed to a pre-med? What would be the advantages and disadvantages of doing, either or?
Do you mean so you're talking about doing a pre-med program instead of a 4-year bachelor?
Yes.
Is that what you're asking?
That's correct. Yeah, I know there are some universities and colleges that offer, they have pre-med program,
Oh.
or or they just the student goes and gets a science degree first and then apply for school.
I know there are some schools, universities that offer a combined bachelor's and MD medical degree. I think UC San Diego used to. I don't know if it still does, but it basically saves you a year. So it's a 6 or 7 year program, but you would go straight through. So after your bachelor's, you would start medical school. That's the advantage of that shorter. It saves you some time and money, and also and once you get into the program out of high school, it guarantees you a spot in the medical school. But then on the other hand, you have to know that you want to be a doctor, like from high school. So, yeah.
Okay, thank you.
Okay, well, thank you so much, Saints, for giving your time for this session. I think it was very helpful. And again, thank you very much for sharing your experiences.